Yes, you're checking 11 right the way down to 15.
Yes.
So yes, I'll move. And
can you formally move it as well?
I'll move the motion.
Yeah, and you don't wish to speak?
I do wish to speak.
You do?
I do wish to speak.
Please speak, yeah.
Yes, thank you. These amendments were tabled by Deputy Coonahan in the Lower House, and Senator Gavin has also tabled. This is in relation to Section 515. As tabled here also. It addresses one of the huge problems with the government's response to COVID, which is the complete lack of data, no investigation into the evidence-based proportionality of measures and the effect that their implementation has had either on the spread of COVID people's lives and livelihoods. Time and time again, impacts assessment, rationale, reports and reviews have been asked for in this House and met with tidbits of hastily pulled together figures, if even that. This amendment places an explicit onus on the Government to prove that their approach is appropriate and proportionate, considering all that is impacted by the decisions in the lives of all the people in this country, instead of limiting their views of public health to the COVID case numbers. I am an independent. I'm an independent senator. I don't need anybody else in this chamber. I don't have a political party behind me. And my amendments are down here solely in my name. So I don't need, just in response to Senator Clifford's-Lee saying that I'm here on my own. These are my amendments. So obviously I'm going to be here on my own to talk about the amendments that I have. Civil liberties have really gone out the window since these new public health measures have been introduced. And all we're seeking here is that a data impact assessment statement would be before this House in relation to the measures that we've taken, in relation to the lives and the livelihoods that we've been affected and the lives that have been missed, the years that have been missed, and the effect that that has on all our society, our young people, our elderly, those that are in isolation, those that are in business. All we want to see is some data impact assessment statement outlining the impacts of the COVID restriction measures that we've introduced. So I'd like that to be brought before the House as part of this particular bill. Thank you.
Senator, you certainly bring a colourful approach to the entire debate, and I thank you for that. And there is no script that could be prepared for me that I could have the answers for it either. So even with all the scripts I have, I'm going to take on board a lot of what you're after saying there, and I'm going to respond to it, if you don't mind, okay? So, and I can only talk from a health perspective at all times, because that's where I sit. I'm a minister within health. So for me to talk about education would be misusing my time and misinforming people, okay? But so I'll talk from a health perspective. And I think the conversation started here with Senator Conway, where he says we need, it goes back to your amendment. Let me reference the amendment. It's about the openness and transparency of what lessons have been learned and what have we taken on board. And I think, to be fair to Minister Donnelly, he did say to your colleague Dave Coonahan in the House at the time that he had certain information that he had no problem with sharing in relation to 2020. That I was there for that part of the debate myself, and I think that information would be wonderfully to be shared. But I think a lot has happened in the last number of weeks, even where we are with the debate and the rollout of it, and even with NIAC's further approval of young people getting the vaccination. So the conversation has really moved on. I think it has moved on to where Senator Buttermore has joined us on it. And really, and I would agree with, I do wonder about the role of Professor McGrath. I do believe that there was something wonderfully working at that point. Any of us who travelled around and had seen our vaccination centres, you talk about Cork, I talk about Galway, and we had a pop-up one abroad in Connemara because coming across the bridge was a problem. But it's not, it's because we're the second largest county in the country, and we needed actually to ensure that everybody, as diverse as it was, could get access to the vaccination centres. The pop-up one in Connemara proved incredibly well. That needs to be reinstated this minute, so as that people would have that similar access to it. And if you want to accelerate something, you have to see what worked really well the last time. And what really worked very well the last time was the role of the army with logistics. They are the people who can actually roll anything out. They actually are, to me, they were the spine of it, while we had vaccinators and we had the people coming forward and we had actually the medicine. It was the role of the army in the whole process made it work very, very, very well. And we need to see where the role of the army can be accelerated at this stage and their involvement on it. But yet again, when you talk about community, the role of the GPs, I know the call was had yesterday, Senator Lee referenced it earlier on in relation to the GPs, but our GPs have always have had broad shoulders in relation to the rollout of the vaccination and again with the boosters. But it's getting complicated now because we have vaccinations and we have new people coming forward, which is very welcome. But then you have the boosters coming on top of that, and now we're going to have the younger cohorts. So we have to see how best it can be done. And for my 2 and 6, for what it's worth, my 2 and 6, I might disagree with you about closing of the schools, but perhaps I would use the time differently. Perhaps there is where I would look to my community health organisations to see if we can actually send them into the schools and see can we use that time appropriately, as opposed to parents having to take time off, overburdening our vaccination centres, clogging up car parking. Perhaps we bring the people to the schools. Perhaps we should, and that's how we should look at looking first at our younger years with those who are medically compromised. So I talk about special schools, special classes and special units. Start there and go right into the schools. And still at the same time, should look at when you go into one school, you may as well do the job than come out the door and leave a cohort behind you unvaccinated. But that's how I think, Senator Buttermore, if I was in charge of logistics, they are there, they're supported by their teachers that they know well. If family want to be there in support, absolutely. They can sit at their desk for their 15 minutes afterwards, so we don't need to use that space in a GP surgery or a vaccination centre. And we need to have an agile approach. And perhaps sometimes when we talk, HSE are fantastic for doing the job themselves, but we need to actually expand the wing that other people can assist us to have that rollout. But community health would know exactly how to do it, and that is my own 2 and 6, is how I would do it. I would use the 2.5 days next week to actually get the vaccinations into the young people, into the schools, so as we would have them protected. So as when they do meet Granny and Grandad, there is a protection mechanism around them, because we know they're going to meet up anyways. So we may as well protect everybody. Now has given the approval on it, so perhaps we should look to see how we can use the resources a little bit different on it. And you are right, there's no silver bullet in this. It's only by talking and communicating as to see what measures can work. And some CHOs will respond differently to others. And if we were to down tools on all staff for the purpose of 10 days for the greater good to ensure you had a vaccination rollout that would be successful, I think that's how it would go. So, to the Chair, I've gone on a little bit, but that's all because of Senator Buttermore.
Sharon Keogan. Sharon, and then.
Thank you, Minister, for your comments in relation to our amendments there. Just in relation to some of the comments we made here this morning about certain countries not getting it right. There's a lot of countries that didn't do things right, and we're part of that as well. But England have done something that we haven't done. They have brought in COVID certificates for those that are medically exempt. And I ask you, as a Minister for Health, that you would look at that. There is absolutely no reason why the people that cannot be vaccinated for a number of reasons cannot have a COVID cert. These people are now able to go. They're banned now from the gyms. The one thing that was looking after themselves, swimming pools, they were looking after their rehabilitation and their physical well-being and mental well-being. That has been taken away from them now. So England may have got a lot of things wrong, but they certainly got that right. They've looked after those that are medically exempt. Europe has been talked about here this morning about getting their act together. There are certain countries in Europe that are making vaccines mandatory, and we do not want to go down that road. That is a road that we certainly don't want to go down. And you spoke this morning about going into schools, and you've got the one thing that is required, and that is consent of the parents to have those children vaccinated. So that is the most important thing. And I just want, just in relation, sorry, don't interrupt anybody. So please, kindly, you can come in after me. So consent obviously is the most important thing. But I want to just read out a tweet that the WHO sent out this week. As school holidays approach, we must also acknowledge that children contaminate their parents and grandparents at home, with a 10 times increased risk of these adults to develop severe disease, be hospitalised or die when non-vaccinated. Vaccination of younger children not only reduce the role in Covid-19 transmissions, but also protect them from paediatric severity. The use of masks and ventilations and regular testing should be standard at all primary schools, and vaccinating children should be discussed and considered nationally as part of the school protection measure. Now, we failed. We failed in ventilating our schools. Money was only allocated this week. Schools now can apply for that. We failed. We took away community testing. We took away that. We brought in at the end of November, where the antigen tests were sent out to the school. But before that, for 3 months, we fiddled around doing nothing. And now there's another tweet here from the WHO. My final third call is not to mandate vaccinations if you haven't reached out first to the communities. Mandates around vaccinations are an absolute last resort and only applicable when all other feasible options to improve vaccination uptake have been exhausted. Now, we are 2 years into this COVID-19. People's choice around vaccination is their choice. It has got nothing to do with me, Minister. It's got nothing to do with you. If someone decides not to have the vaccination, that is their choice, and I respect that choice. People are now more aware of what you have to do to keep yourself safe. We all know the mitigating measures. We all know the lines of defence that we need to take. And people might try to swing you in to a far-right group just because you stand up for those people that do not want to take the vaccine. And I will stand up for those people in here. Whether I'm vaxxed or not is of absolutely nobody's business. In fact, actually, I think we all got an email in here today from a journalist seeking to find out whether I was vaccinated or not, and was I taking the booster. It's nobody's business. My medical history is my business. It's nobody's business. So they're the things that I wanted to just speak to you about. And, you know, I'm really not happy about what's happening in Austria, mandating every single citizen to be vaccinated, fining them, interning them, detaining them if they're not vaccinated. We don't want to go down that road, and we should not even consider going down that road. But, you know, we have to be very, very careful. There are people out there that we have left behind, those people that are medically exempt. We have to please, before we leave these houses on Friday evening, or before you leave on Thursday evening, that some piece of legislation is brought forward that those people will be able to access a medical COVID certificate for those that are medically exempt. Thank you.
Just one last contribution before I finish up. I think in my contribution with my engagement there with you, Senator Buttimer, at no stage am I saying we force vaccinations on anybody. It's a choice. I need to make that clear. It's a choice for parents. I believe in a whole lot of everything to do with choice-based approach, absolutely. The only one people I forgot to speak about when I talked about what we've seen very successful was the retired people who got involved in the vaccination process. And if we could put out a cry of help for them to come back on board. They gave invaluable amount of their time from the retired community, and they have a whole experience and skill set there that should be embraced and used at this moment in time. And in relation to medical exemptions, I've already worked with the HSE myself within disability for an exemption mass pass for persons that has disabilities. That is already designed. It's done with the HSE. That can be handed out, and it's encoded from HSE backing that persons that have a disability, they can't wear a mask. That is what I have done within my department. I'll take on board what you're saying in relation to the medical exemptions as well, and I'll bring that back to Minister Donnelly. But from a disability point of view, I have a mask pass designed and approved, ready for rollout. And in relation to the air filtration system, I think it's welcome that Minister Foley has given such funding to the schools. I do think they need to embrace the time over the Christmas period to take it on board and to ensure the rollout of it. So, Cathaoirleach, I have nothing else to add.